how do I reduce menstrual cramps? How do I get rid of menstrual cramps fast? What causes menstrual pains? Any drugs, any reliefs, any cure, any solutions, any home remedies? Watch till the end of this video and get the answers to these and more, and I have a free gift for you at the end of it all. Hello, my name is Dr. Malik Haruna King, and on this channel I supply you with practical tips to help you stay healthy, fit, happy, and of course enjoy robust sex. So if today is your first time here, consider hitting the subscribe button and turn on the notification button so you will be the first to get my new videos. So how do you handle menstrual pain? First, you have to discover what works for you. Pain has a lot to do with the mind, and different ladies have different ways of reducing pain. So you have to discover what works for you and embrace it, provided it is not harmful. Number 2, use heat. Heat helps relax the contracting muscles that cause cramps. So you should apply heat to your lower abdomen and your lower back. You could use hot water bottles, heating pads, or you could compress with a towel soaked in warm water on your tummy, especially below the navel. This could be very helpful. You could also consider soaking yourself in a hot bath or taking a hot shower, but just be careful not to burn yourself. Number 3, massage your abdomen and lower back gently. Putting firm but gentle pressure on the affected areas can help relax the muscles and relieve the pain. Number 4, distract yourself by doing something that normally absorbs you completely or distracts you completely, like socializing with friends, reading a book, playing a game, watching a movie or TV show, spending time on social media. Or you could consider trying your hobbies, lying down under a revolving fan, try drawing, play some music, sing, dance, go out for a walk, and so on. Number 5, try some behavioral practices like relaxation, deep rhythmic breathing, prayers, acupuncture, and hypnosis. For example, breathing deeply from the tummy and seeing it rise and fall is a very helpful way of relaxing. Number 6, take supplements. Many dietary supplements have been shown to reduce cramping. For example, vitamin D, vitamin E, vitamin B1, vitamin B6, fish oil, or cod liver oil. Stay hydrated. Don't allow yourself stay thirsty for long. Number 8, change your diet. Cut down on sugar, sweet, and sugary stuff. Cut down on junk and processed drinks and foods. Diets that are low in sugar and fats but rich in minerals and vitamins help decrease menstrual pain. For example, fruits and vegetables, green leafy vegetables, bananas, pineapples, berries, and so on. Dark chocolate, salmon, and other fishes are rich in omega-3 fatty acids. Oatmeal, soybeans, and nuts work magic for some ladies. Number 9, drink tea. First, the heat in the tea helps. Secondly, the teas also help to keep you hydrated. However, avoid caffeinated teas because caffeine could cause anxiety and tension, which can make your cramps worse. Number 10, avoid alcohol and tobacco. Nicotine in tobacco can increase tension and cause the narrowing of your blood vessels, decreasing the blood flow to your womb and worsening your cramps. Number 11, exercise. Exercise releases endorphins, which are natural painkillers, and also endorphins help to counteract the prostaglandins, which cause contractions and pains. So go for aerobic exercises like walking, running, cycling, swimming, dancing, skipping, or taking a class at the gym. Number 12, do simple stretches. Try simple stretches to stretch out your back or abdomen depending on which areas hurt the most. Also try curling into a ball. Number 13, increase your sexual activities. Some women experience relief from menstrual cramping with orgasm due to the endorphins that are released during sexual arousal. So sexual activity is therefore great during menses, especially for those comfortable with this practice. Number 14, try yoga. Similar to aerobic exercise and stretching, yoga helps relax the body and reduces pains in the lower back, in the legs, and in the abdomen. Number 15, take painkillers. Non-steroidal anti-inflammatory drugs such as ibuprofen or Felvin or diclofenac are very effective. Start taking them few days before when your cramps usually start, because if you wait after the pains start, the drugs may not work or may not be very effective after all. Make sure you eat well before taking these drugs, because these drugs are strong and they could irritate your stomach. Number 16, use hormonal birth control. If natural remedies, diet, nutrition, exercise, and painkillers don't work in a satisfactory manner, hormonal birth control may be advisable for severe cramps. The method you get to choose depends on your general health, your sexual practices, your personal preferences, and your financial preferences. Now, so you have to discuss your options with your healthcare provider. Number 17, of course, see a medical doctor. If your cramps are more severe than usual, if your cramps feel unusual for you, if the timing or location of the cramps is different, if your cramps last more than 2 to 3 days, you have to see a medical doctor, because we know that disorders like endometriosis, pelvic inflammatory disease, infections, fibroids, and so on can cause severe menstrual pain. So see a doctor to help you identify the cause and fix the cause and reduce your pains. Did you learn anything new today? Don't forget to hit the like button and stay subscribed. And I have a free gift for you. It is an ebook titled Fire Your Doctor, and it gives you 30 timeless tips to help you enjoy total health, ideal weight, and better sex. And you can get it through the link in the description section below this video. Take charge of your health and happiness.